We have got the amazing Rhonda Holman here with us tonight. Yes, it's so hard to do a curtsy when you're already sitting, right? In a dental chair. Um, most of you have seen Rhonda on our webinar before, but just in case you haven't, she is a 24-year veteran in our dental space. She was in the Air Force, correct?
Yes.
I got that wrong last time. That's not a good thing to get wrong. Served in the Air Force, came out. She's been working in dental. Her passion is airway. She does a lot of things that we're going to get into tonight. Basically, we'd love to invite you guys into this conversation. That's the goal. So Ron and I, we're going to talk more of a Q&A style tonight versus content that we're throwing at you guys. And that's the California version for y'all, just in case anybody was wondering. But yeah, let's kick it off, Rhonda. Anything you want to say before we start getting into some questions here?
I would like to tell you I identify as a recovering mouth breather and a former floppy tongue owner. And that makes me the best advocate for my patients who are also recovering mouth breathers and floppy tongue owners.
Floppy tongue owner. I've heard recovering mouth breather. I've never heard former floppy tongue owner.
It comes with a package. In order to mouth breathe, you have to drop the tongue and it starts to atrophy over time. So vis-a-vis, we got ourselves a floppy tongue.
Yep. Yep. All right. Okay, we'll go with that. Hey, you know what? Actually, one thing I forgot to tell everybody who's attending, your questions matter more than ours. We're here for you all. So if you have questions, please stick them in the Q&A. If we ask you all questions, please stick your answers in the chat. You already did great on that with tuning in or telling us where you're tuning in from. So if you've got burning questions about myofunctional therapy, anything the team is doing in dental sleep medicine, or I'll just leave it at that. We'll focus on the team and airway. How's that sound? And throw in some myofunctional therapy. But if you got questions, we will hopefully have answers. So please throw them into the Q&A. All right. Well, let's get going on this. Yeah. Let's start off with our first one. So this is not the first question I thought we would have, but they are pulled from the folks that are attending that registered. How does sleep hygiene impact oral appliance therapy outcomes?
Great question. So let's say you prescribe somebody a mandibular advancement device and you have it perfectly fit and you have tested it with them wearing it and you have great numbers. Like you are helping this human being breathe better while they sleep. Okay. But they don't put it in. Or they, fall asleep and then at 3 a.m. they wake up, their typical wake up time to urinate. And then they're like, oh, I forgot to put this in. And they put it in. So when you think of like sleep hygiene, it comes down to like a series of events that lead up to the minute you close your eyes and fall to sleep. And so sleep hygiene is a huge deal when it comes to setting these actions that ensure your patient wears their oral appliance. I have patients. I've been there, done that. I'm one of you guys. We get them this perfect appliance, right? And it's perfect in every way. Fits great, feels good, tests great, and then they fall asleep in their child's bed, and their oral appliance is in their bathroom on the other side of the house.
Mm-hmm.
And then when you ask them, have you been wearing your appliance? And they say, when I remember to wear it, or when I don't fall asleep in my child's bed or on the recliner, or, vis-a-vis, in whatever you want,
Mm-hmm.
then you think, okay, well, we should probably work on sleep hygiene because we need to set up a series of events before you go to bed that you do every night to ensure that you are compliant with your appliance.
Yep.
Especially if that patient is one who's trying to convert from a CPAP to an appliance and they're like, oh, I don't need my CPAP anymore. I'm like, but you have to make sure you're wearing your appliance every night. Otherwise, you're worse off than you were before I had my hands on you.
Yes. So, I mean, this is kind of like clear aligners,
Yes,
but more important, right? And
absolutely.
they don't have to wear it 22 hours a day. They only wear it 8 hours a night. So
Mm-hmm.
that is obviously a rub. What Rhonda, we're always thinking about this from a coaching standpoint. Like, what are the practical pearls that people can pick up? You do this hands-on. You have patients in the practice that you personally work with, your sleep coach. Like these are things that you do. How do you coach patients, or what do you do, handouts, or what things have you guys done that have worked for patients to have better sleep hygiene and have a better compliance to their mouthpiece?
Yeah, absolutely. We have handouts, but I like to slim it down to three things. So I ask my patients when they get the appliance, you guys know this is null and void after about 2 months, and they can't sleep without their appliance. But we're talking about this struggle growth phase when they're first adapting to sleeping with stuff in their mouth. And so I'm three things. I was like, I want you to commit to three different things every night for me. And so there's a really good book if they want to learn more. It's called Atomic Habits. And we highly recommend this for our patients because it gives them kind of a blueprint on how they can rewire their brain. So we call it pairing, right? So I tell my patients, okay, I need you to do the same three things every night, no matter what. And I say, can you give me two things that you do already? And they'll say, well, I plug my phone in, I walk the dog or let the dog out, or I lock my front door, or I load the dishwasher, or I make sure that there's no clothes in the washing machine, I turn the lights out. I'm like, okay, well, give me two of those. And every time you do that thing, I want you to say, tonight I'm going to brush, floss, and put my appliance in before I even hit the bed. And so they're locking that front door and they're thinking, tonight I'm going to brush, floss, and put the appliance in. And so when they get to that second action, when they're, turning the dishwasher on, tonight I'm going to brush, floss, and put my appliance in.
Yep.
And then eventually that rewiring will happen until they adapt to the appliance and then, won't give it up for anything.
Yeah. I love, so you bring up Atomic Habits, and that scratches the business side of my brain. Them talking about keystone habits, things that have this cascading effect in our lives, like those anchor points. So you're trying to grab something that already exists, that's familiar to the patient, that's different for everybody, and then have them attach, brush, floss, put my appliance in.
Yes.
Okay. Y'all didn't
And
write that down.
I even give them out. I say, listen, for the first week or two, if all you do is make that thought pattern happen, but you don't action items on it, like say you don't brush and floss, but you put the appliance in, or brush and floss and forget your appliance, just give me that pattern for at least 2 weeks. And I promise you, there's going to be a day where you lay down in bed and you think, what did I forget? I can't go to sleep. I'm forgetting something. Because that neural pathway is set the minute you make these conscious efforts of thought. It's really neat.
That's really cool. I love that. On that note, you said you have handouts, but you've tried to slim that down because people don't like paper.
They don't like they're paper phobic. No.
Yeah.
We make
What do you
videos.
hand out?
I do a lot of videos. So I made like a Zoom account for my airway patients. And I'm like, okay, well, I give them an exercise video, I give them a sleep hygiene video, and I give them like a food and anti-inflammatory diet video. And they seem to like that better because then it's not like in their face when they're in the practice, but they can like open up their phone and look at it later. And I feel like people are more likely to implement it when they see my face again and hear my voice. And then it's just a little bit easier than pulling a paper out and reading it and be like, oh, what's on the news?
Right.
But when they're looking at their phone and they see me, because I've told them, I said, I'm going to send you these links tonight. I want you to look at them and tell me next time I see you what you were able to modify and change and how it's going. So I make them accountable to me, but I also make it as easy as possible for them to learn what it's going to take to improve the way they breathe while they sleep.
Gotcha. Okay. That's awesome. So you've got a pairing of, you've got minimal handouts that they're likely not going to read and they might throw away. Second, you're connecting their personal habits, what they do every night, to the brush, floss, and put their appliance in. And then you've got the videos and the accountability of them reaching out to you.
Oh, yeah.
Okay. How frequently or how quickly are they reaching out to you post delivery and all of that?
Well, I do a 1 week follow-up. So
Okay.
the minute we put the appliance in, I call the next day just to get a verbal confirmation that everything went okay. They were able to sleep in it. Their jaw didn't hurt. Their teeth don't hurt. The
Yep.
bite isn't completely off when they wake up. And then I say,
Right.
you know what? We're going to check back in 6 days from today. And we're going to see subjectively how you feel. And then you're going to prove it to me. I'm going to send you home with that sleep test again. And we're going to
Mhm.
see how you're breathing. And then every day you do a little bit more of the work with
Mhm.
getting the fascia released, getting the tongue stronger, slowing down the nasal breathing. All of that is going to help you breathe better while you sleep. Because I really don't think it's just the oral appliance.
Yep.
I think if you want success, you have to look long term, and you have to do you have to modify behavior. I mean, it is what it is. A
Sure.
lot of people don't get here without behaviors that got them there. Whether it
Yeah.
could have been in childhood, nasal congestion, adenoids, tonsils blocked you just became a mouth breather, or you're not even a mouth breather, but your tongue is weak because of our diet here. Everything you eat is ultra processed, so you're never getting any workouts for the upper airway. But
Right.
I will say, I have a family member who was in an oral appliance and it failed him. But I don't think it was the appliance. He ended up going to a CPAP. I
Mhm.
think it's non-compliance. He didn't do anything to try and get his mandible to posture forward on its own. So as his tongue was getting weaker and weaker over the years, that appliance had to do more and more to keep his
Mhm.
mandible forward. So I always say you should always pair an oral appliance with myofunctional therapy exercises to strengthen the tongue so you can get the tongue to stay suctioned to the roof of the mouth during sleep, which will help take that pressure off of that appliance. So it's really a 1-2 punch.
Yep. I love that you brought up the 1-2 punch and the way that you frame it as we got here for a reason. You're going to have a stabilizer, the appliance itself. What can you do to help that, to support that? Um, I love that. So this is a perfect lead into our next question, actually. Uh, what is myofunctional therapy? Pretend that most of the people on this call have heard these terms. Some of them have been to classes. Pretend we're in fifth grade. Talk to
Okay.
us like we're your actual patients and tell us what is myofunctional therapy.
Okay. So if you go to a physical therapist, their job is to help you improve muscle tone and function, whether it's an arm, a leg, another body part, fill in the blank. Our job in myofunctional therapy is to be the PT for the head and neck. So getting the muscles nice and toned, working on the smooth muscle and getting the tongue operating functionally so that it stays strong. So a lot of the times you'll see with a patient that has struggled with breathing while they sleep, they also have, comorbidities, right? And one of those tends to be like an improper swallow. So myofunctional therapy aims to help people understand what a proper swallow is so that once their tongue is strong enough, the way it needs to be to stay suctioned to the palate at sleep,
Mhm.
they also know how to swallow to maintain that strength. That's my best way to describe it. It's PT for the head and neck.
Gotcha. Um, so essentially you're doing the workout with the tongue, with the muscles. You're showing the patient the exercises to work out like that. And they're doing the work, they're building the muscle tone. Is that correct?
They're building muscle strength
Muscle strength. Got it. So
and
essentially,
getting the
go
proper
ahead.
swallow to maintain that strength.
Got it. Got it. Cool. Um, what is your favorite myo exercise?
I like the cave. It's where you suction your tongue to the roof of your mouth while opening as comfortably as you can wide and maintaining that suction for 30-second intervals. I like it because it's what your tongue is naturally supposed to be doing when you are at rest. So the only difference is with the cave is you're showing people and you're showing yourself. A lot of these are done in front of a mirror, which is fantastic.
Got it. Okay. So you get to look really awesome in front of
Mm-hmm.
the mirror. Um, do you have patients complain about this?
They do feel awkward. There's for some reason, a stigma, I guess, against showing how to strengthen the tongue, which I don't understand. I don't know if maybe culture did that, where it was goofy if you stuck your tongue out. And so they just associated it with, oh, this is silly. I don't want to do it in front of anybody. And a lot of them won't. And that's fine.
Yeah.
You're not doing the tongue exercises to appease other people. You're doing it so you can help yourself breathe better while you sleep.
Yep. So I didn't intend on doing this, but I'm going to ask to put you on the spot. Can you show us a few, since you do this with patients all the time? Can you show us the exercise and then explain what it's doing and how it's helping?
Absolutely. So we narrowed it down to 5 exercises. And remember, the caveat to this is I work with mostly adults over the age of 40. I don't work with children, and I am just the liaison between my doctor and the patient, trying to help them implement these routines to make their tongue stronger. So our 5 are the cave, which is suctioning the tongue to the roof of the mouth while opening wide as you comfortably can and holding that suction.
Okay.
Now, remember, they call it the cave for a reason. So if your whole tongue is suctioned up, it will look like a cave. If you can see the back of the tongue is still down, you won't get that effect of a cave. Michael, you got it. I see a cave in there. Very nice.
It's a big cave, but
it's a very nice cave. Because I try to tell people all the time, I'm like, we name these things so that they're easy to remember and they remind you of something that you've seen or done or heard of. The next up is jawbreakers. This is where we use the cheek as resistance training. So we stick the tip of the tongue out, pushing on the inside of the cheek, and we hold it there. And most of these are 30-second intervals and 3 sets. We tell our patients do 3 sets in the morning of each of these and do 3 sets at night. And that way they have a nice long time in between so they don't strain too much when they're first starting. But a cave is, it's actually 2 exercises, since you have to do the right side and the left side. So this is the right side.
Yep.
Why do you think we call it the jawbreaker?
Because it looks like you have a jawbreaker in your cheek.
See? Yeah. It's so easy to remember if you work in finance or you're, a plumber. What's that? Oh, it's that candy one. Yeah, I'll do the candy one.
The candy one. Yeah. Easy to remember, though. Okay.
And then the left side would be the opposite side.
Yep.
And this is going to help with the sides of the tongue, strengthening it. And it's interesting. There's a lot of people that will say that one side is harder than the other. And then if you look at significant asymmetries in some of our patients, you understand why. Like a lot of them maybe sleep on the same side for 10 years in a row, or they've got some type of trauma. I mean, there's a lot of reasons why some will favor the other. And it's really interesting because they'll tell me like a month or 2 into it, like, you know what? When I was doing my left jawbreaker, it hurt like the dickens until one day they were just equally hard. I'm like, oh, that's great. You're starting to regain some of that balance in the muscles of the tongue.
Got it. Okay, so that was 2. You said there's 5.
Right. And so now we have, technically that's 3, because I identify as the right jawbreaker is 1 and the left jawbreaker is another. And then we have tongue to the spot. So that's elevating the tip of the tongue. So again, opening as wide as you comfortably can while maintaining the tip of the tongue on the incisive papilla. So you're just holding it there. I like to tell people this is like, show me your pizza burn.
Okay.
Because that's usually the spot that gets the pizza burn when you grab the pizza and the cheese is too hot.
I hate eating hot food.
There's a lot of risks involved.
Okay. Show me your pizza burn.
This is show me your pizza burn.
Oh, Lord have mercy if we do social media like images or videos from this webinar.
Well, you have to think too, a lot of these, they're targeting a lot of different systems at one time. So not only am I asking you to do things, postures, positions, stretches that improve the strength of your tongue, but I'm also asking that you breathe through your nose. I'm asking that you try to maintain as good a posture as you can. I'm asking you to stay still. So you're really concentrating and focusing. And so I love a lot of these, especially the jawbreakers, because with the tongue to the spot, a lot of people will try to mouth breathe when they're doing this. I'm like, well, remember the rules. We only breathe through our nose, and we try to sit upright, and we try to make sure that the accessory muscles on our face aren't moving. So
Yep.
we want the tongue to move independently from the muscles of the face.
Got it.
And a lot of them, what they'll notice is if their tongue is really weak, when they're doing tongue to the spot, eventually they like get a very small opening. I'm like, what happened?
Oh.
Like you were opening so wide, but as the
Mhm.
tongue got weak, they compensated and just started closing ever so slightly. So there's tools like bite blocks, especially if you have a patient who is having a really hard time maintaining that open posture, that they can kind of wedge in here in order to keep the tongue elevated to the spot.
Got it. Cool.
And then I love, okay,
Go
did
ahead.
you guys ever see the movie A Christmas Story? You know, where like the guys, you're to shoot your eyeball out, Red Ryder BB
Alfie.
gun. Yeah,
Yes.
I mean, who hasn't seen that? Do you remember when they're in the play yard and one of the kids sticks his tongue out and freezes it to the pole? It
Yes.
was traumatic, especially if you're in the dental world. Like seeing that was like, oh my gosh, could that really happen? And then everybody, that I knew went and tried it, and it didn't work. So I think it was just for the movies. Turns out
So,
if you blow enough hot air in that area, the metal will warm up.
right. So the
I guess
last
it depends
one.
on the temperature. So that's skinny tongue. So you stick your
Mm.
tongue straight out, trying not to let it rest on your lower front teeth or your lower lip.
Mm.
So pretend this. You can use your finger. You can use a
Mm.
lollipop. I use a pen. I do like to have a guide because it's very helpful, because a lot of times it's just like the other exercises. As the tongue muscles start to fatigue, you end up coming in. So this gives you just
Mm.
somewhere to aim.
Got it. Okay. All right. So if you all are note takers, Rhonda's going to re-say these 5 in order so you can write them down.
We have the cave. We have the jawbreaker right.
Mm-hmm.
We have the jawbreaker left. We have tongue to the spot. And we have skinny tongue. Now, if you really want to supercharge that skinny tongue, you guys, lay down on a bed or a floor. Point your tongue straight up to the ceiling. You'll feel the workout. It's
Interesting.
really good. Yeah, if you want to level up.
Well, hey, speaking of that, we have somebody asked a question. Lana asked a question. What's the name of the appliance you were talking about in the beginning? That was the oral appliance. You want to go into that a little bit?
Yes. So oral appliance therapy is what we use at our office for those who are not interested in CPAP or are CPAP incompliant or non-tolerant. So this is an appliance that is custom made that helps to titrate the mandible forward, bringing the tongue up and out of the airway while posturing the mandible forward. And I really like this, especially for patients that, they've got a long road ahead of them. Maybe there's, everybody's in a different place. Maybe they're morbidly obese, or maybe they are struggling with depression or anxiety. All of these things that might hamper their ability to do these self-care methods is what we're talking about. I mean, this is behavior modification. We are asking them to work out so that they can get their tongue and upper airway stronger so that it's easier for them to breathe while they sleep. A lot of people, might take a minute. Sorry.
It's okay.
Let's see. I lost you guys. Let's see.
We can still see you.
Okay. Oh, looks like I'm coming back in. There we are. Ooh, am I doubled up now?
Nope.
Okay. So a lot of people, what they'll do is they just need to breathe better while they sleep so that they can even begin to start thinking about self-care. And so a lot of times that looks like getting an oral appliance in their mouth, bringing their tongue up and out of the airway, and bringing their mandible forward so that they can finally get what is considered sleep. Maybe a little bit of REM, a little bit of deep sleep, something that they probably have been missing out on for quite a while. And then once they start feeling rested, they really do start to say, you know what? putting this thing in my mouth helped me sleep better. What else can I do on top of that?
Yeah. I love that it's ownership. You're basically transferring psychologically and verbally, you're transferring ownership to the patient for their care. Dr. Nelson is handling managing the oral appliance therapy. You're working alongside of her, working with them on the myofunctional therapy side. Two therapies, but in your example earlier about physical therapy, if the patient does nothing in physical therapy, they're non-compliant, they don't get better. They're not working. So the fact that you're bringing the patient into, I'm owning this is my therapy, this is my solution, I have to work at it, and you're helping them create habits. I love the nuance of that. We have more compliant patients when they own their care. We have more compliant patients when they have skin in the game and they have paid for it, they earn it, they work towards a solution together in collaboration. It sounds good on paper, but it's way better in real life when they're actually doing it.
Yeah. And a lot of times what they really need is an accountability buddy. They don't really need someone to say, oh, you're not doing enough. You want to say, hey, what did you get to do? And I'm really proud of you. What I like to do with our patients, the minute they go into what we call the airway protocol, which is the minute they decide to help themselves breathe better while they sleep. And we say, okay, we're going to get you scanned for this appliance. Now let's go over sleep hygiene. Let's go over getting the muscles of your upper airway stronger. Let's go over, how we can breathe through your nose without resistance. So what can we do? Can we do some nasal dilators? What would help you? And then we take a cave photo. Remember that first exercise?
Mm-hmm.
And I document it. And I love that because in 2 months, 3 months, we take another photo and I put them up on the monitor side by side. And I say, this is you, and even if there's not a significant amount of difference in the muscle, like in the muscles of the tongue, like as far as getting the whole thing suctioned up, I say, hey, look at that left side. It curls in again. Like, remember last time in this picture, it was you were sitting over the occlusal plane, like your tongue was covering those teeth. Look at it now. And like, you're just getting so much closer to your cave.
Yep. That's awesome. It's cool that you can take the photos to document progress as well. Because I think, if they're going to own it and they're going to work at it, seeing the progress in their own health, like they're going to see the benefits, but then being able to tangibly see that side by side is a pretty cool thing.
Agreed.
So you're doing the intraoral photos at the time that you're taking impressions for the appliance. Is that correct? Okay.
Yeah. So when we scan for the appliance, that's when we also do our OMT starter kit. And that includes like I said, the sleep hygiene, the Buteyko breathing is what we use for patients that have a hard time adapting to breathing through the two nostrils when they're so adapt to breathing through the big hole. And they're like, I'm not getting enough air. And so I'm like, well, how can we A, slow down the breathing, and B, how can we just make it easier for you to pass air up and through, whether that looks like an internal nasal dilator, external nasal dilator, sleep hygiene with some nasal hygiene, added to it, making sure there's less mucus in there for when they put that appliance in at night for them to feel like they have decent amount of airflow through their nose.
Yeah. Yep. Exactly. So I was an anti-nasal breather and now I'm a nasal breather, but I had to have surgery for that stuff. So how do you deal with people like me that have the big floppy tongues and they're apneic and they're getting an oral appliance and yet they have physical occlusion in their nostrils where for me, when I tried to breathe through my nose, even with nasal CPAP, which is blowing more air in, it caused anxiety. Like I actually have oxidative stress because I can either breathe in or out, but I can't do enough of either one. And so I start to freak out pretty quick. What do you do when it's an actual occlusion or it's not a mindset or a musculature thing? How do you handle that?
We refer. we have this lovely set of ENTs in our town who are more than happy to Roto-Rooter for you. And, it's nice though, because a lot of people, especially in our space, have deviated septums. Some of them are occluding, some of them are not. And so I think it's really important to try the first things first. Let's go from it like get rid of the inflammatory foods that could be considered like to causing you excess nasal
Yeah.
mucus or excess inflammation in the sinuses. And then once we get rid of the foods and you're still struggling to breathe, that's when we're like, okay, let's work on Buteyko breathing exercises. If
Mm.
that's not enough and these dilators aren't enough, then I say, you know what? You gave it a Girl Scout try. Looks like we got to go over the ENT after all. But a lot of them, they want to try a holistic route because
Mm.
they want to see if there's a chance they can make what they have work better before committing to, something that's more structurally altering.
Yeah. Yeah. Carice actually asked a great question, was in the chat. So I wanted to take this real quick since it tangents right along with what you said, Rhonda. She said, should we establish that first, especially if we're doing an oral appliance, making sure that they can breathe through their nose or not? I'll take this first if that's all right, and have you add on. There's a lot of appliances out there that don't require nasal breathing. Now, it's not ideal to mouth breathe, but if someone has moderate apnea, severe apnea, mild apnea that's highly symptomatic, they can't breathe through their nose. Let's say it was me 10 years ago before I had nasal surgery. I want an answer to my oral airway issue. I have an airway issue in general. I would like to have my apnea fixed. And if I've tested positive, I want to have an appliance that will fit that while I can work on getting my nose rotor-rooted, having myofunctional therapy exercise, like all of these things. So, Chris, I think that's a great question. I think it's also in context. There are some appliances that require nasal breathing and you can't wear them. I mean, you're locked in. That would be a bad thing to give that patient if we don't know ahead of time. So I think to that point, it's a good idea to know it in advance.
Yeah,
Rhonda.
which is why we do this myo packet, like this whole handout when we scan them. So before they even have their appliance, we'll know, can you breathe through your nose?
Got it.
And so it could be as simple as holding a card in between their lips for 5 minutes while you're filling out a paperwork.
Mm.
If they can't maintain that lip posture in a sealed state for 3 to 5 minutes, then you already know nasal patency is an issue. That's
Boy,
going to help a lot.
come into your office to just get scanned for that appliance is a bag of tricks. Holy cow. I gotta stick something in my lips, put my tongue to the roof of my mouth. You're gonna take pictures of me in the most awkward position possible. It's awesome.
It's worth it.
It's
A
awesome.
little bit of work on the front end is getting our compliance rate higher and higher every year.
Yeah, that's awesome. Hey, let's I know the main topic here is not money, it's always people. We believe in people first and money second. And profit is to a business as blood is to the body. It's not the reason it exists, but without it, it doesn't exist. So, how do we build this into the practice? Myofunctional therapy, the myo packet, everything you're talking about, where does this fit and how do we actually charge for it as a practice?
So for us, it's $100 per visit. We go through different tools that we recommend or hand to the patient, show them how to use them. We keep them accountable. That is a team driven thing. My doctor doesn't have time to do that. So she sent me to AOMT. I learned alongside her all the things that she needed to learn and that I needed to learn to help my patients. And you realize that a lot of these people, um, they have other dental needs. So let's say I have a patient brand new off the streets. I see them, they have a ton of dental needs, and they also have sleep disorder breathing. So one of the things we do when we first meet them is we take all these records, we have these questionnaires, we send them home with a sleep test if they're open to it.
Mm-hmm.
And we'd love to use your language, Michael. Would you like us to rule out sleep apnea if it's possible? So let's go ahead and get you tested. Because again, people rather rule out something than rule in it.
Yeah.
And it's really nice because if I didn't have myofunctional therapy, if I didn't have sleep hygiene or anti-inflammatory diets or Buteyko breathing methods that I could share with my patients, they would be at a loss for sometimes months on end until they're able to restore their dental needs and then have an appliance made.
Yep.
And so I see a huge benefit is it, especially in that particular case when someone isn't a candidate for an oral appliance yet because they have so many restorative needs. That myo, that sleep hygiene, that buteyko breathing, that is all going to help them in the interim start righting the ship.
Yep. Yeah.
And there's financial gain in it, especially, you know, if you have it set aside to, you know, it's $100 a visit. We're going to spend an hour with you. We're going to be your coach. We're going to be your advocate. We're going to help you help yourself.
Yep. Yeah, I love that. And again, it does speak to the ownership mentality that the patient has, right? They're signing up for almost like health trainer, different version. Please don't take that as disrespectful, but if they're not using the weights in the gym and the treadmill and all the things that they have access to, then they hire somebody. They could do these mouth exercises on their own, but they're asking for assistance. They're asking for that accountability partner walking through the journey. We coach several, we coach lots of clients across the country. We have several that are doing this, and they've added it in different ways. Some are doing it the way that you had shared, like one visit at a time. Others will, if they're fee for service on the oral appliance, they'll bundle it into an airway package and they'll include those first like 3 or 4 myofunctional therapy visits. Like this is included. There's a lot of value. Here's all the bullet points of value in the airway plan. And then anything beyond these 4 visits is X dollars per visit, something like that. So for all of you are in different places, different practices across the country that are on tonight. There's lots of ways to do it, but you can do it. And it's worth it to help your patients. Let's get them involved, get them cranking. We have a couple of questions. I'm going to deviate from our questions that I've got in the slides to make sure we're answering the folks that are tuned in. David Wheeler asked, what is or how do you determine the target respiration rate for sleep? If the rate's too high, what do you do?
So if someone's breathing 19 breaths a minute versus 14 breaths a minute, is that to clarify?
I think so. Yeah.
Well, I mean, that's where buteyko breathing really comes in, is learning how to slow down the nasal breath. I mean, our goal, I tell my patients all the time, I'm like, I want you breathing slow and silent through your nose when you sleep. Mm-hmm. If it's still audible, then we still have work to do. And their respiratory rates per minute, I mean, you think about that, a lot of it could be a combination of a lot of things. Did they eat 3 hours before bed? Just having that digestive process stuck. Mm-hmm. You think about the weight on the diaphragm from a full belly. Like there's a lot of factors that come into play. Did they have coffee? Are they, do they have a lot of like extra stuff that their body is trying to deal with to where they're rapidly breathing and they're not able to get that slow rhythmic breath so that they can reach, like for me, even with all this work, I'm still about 14.9 breaths per minute. Which, I mean, considering where I started at 20, I think that's a success. And but it takes a long time because breathing is rhythmic. So you have to learn to slow it down during the day if you want to slow it down at sleep. And so a lot of my patients, I'm like, I know you want to sigh. I know you're irritated with Bob, Sue, or Jim. I get it. Yeah. But you can tell them you're irritated in other ways where you don't have to sacrifice your breath and offload too much CO2, which is the signal for the body to take the next breath. You could hum it out. So, see, right? They know something's wrong. They've irritated you or wronged you in some way, but you're not sacrificing your breath and trying not to hold your breath. A lot of people, if they have excess inflammation, they'll, I was guilty of this. I would suck in a lot. And so I was holding my breath periodically throughout the day. And I didn't even realize it until I started losing the inflammation that weird program that I'd set up to inhale and exhale only, like if it, meant my stomach was sucked in, that goes away. So it was like, it was intertwined. It was my self-conscious dictating my breath instead of letting my breath, help heal me.
Yeah. That's really insightful. And I love the the soft connectors to all aspects of life. It's what we intake, it's the food, it's the drink, it's the caffeine, it's all of those things, it's alcohol, it's all of those things. And on top of that, it's the psychosocial stress. It's all of these, like, we're pre-programmed in the way that we compensate and deal with things. That's, I mean, the genius in the design of our bodies and how much we can handle and things that we do to offload this. But if we do it subconsciously, it can potentially be harming us. So how do we offload that in a way that isn't harmful? I love that probably gets into big conversations with patients that we don't have time for tonight, I'm sure. But yeah, that's a good point. I'm not sure what the answer is to this question, but David did ask it, so I'm going to ask it for him. How can we get a copy of the Myo packet? Is that a proprietary dental office thing that you all have? Is there a generic version that you have?
I made it from scratch, but I based it off of pieces of work from like the AOMT book. And so I kind of like pieced it all together. I do like, and I don't have it with me, but Dr. Liao, I think is how you say his name.
Mm-hmm.
I have one of his books upstairs, which is really good. It's more for pediatrics, but this is one of the books called License to Thrive. Yep. It's a great read. I highly recommend it. It's the integrative approach. So a lot of this is, you could just make a cheat sheet for, you know, how to avoid inflammatory foods, how to not eat 3 hours before bed, just to make sure that you're done digesting, how to, you know, raise the head of your bed so there's a slight incline, how to move some of your fascia. And it's really, I think the best way to do this is become the patient first. Because there's going to be a ton of stuff on the market that you could buy that has all these promises to help you. But unless you try them for yourself and you see, is that a waste of money? Or is that something that I would implement in my practice and say, hey, this really works. I recommend you do this. But it doesn't look like a big packet. So for our packet, I have one page that's food, right? That's anti-inflammatory and inflammatory foods, like the typical ones. Things that will make it harder for you to breathe through your nose and things that will make it easier for you to breathe through your nose. And then I have the Myo packet, the 5 exercises. I'm like, look, can you commit to these? You know, I just want a little bit in the morning, a little bit in the afternoon. Do it in the car, in the shower, while you're washing dishes. Anytime you don't have to talk, I would love for you to try these out. And then I have the Buteyko breathing packet. So a lot of people have the nasal congestion. There's a Buteyko decongesting. I highly recommend. I have like 1 million books. And if you wanted to rent your books out to your patients, that is a great idea too. I've done it a lot. So I have a huge library of airway information, and I'll tell my patients, you know, rent this out and then bring it back and, you know, we can talk about it. And I think it's easier for them to learn on their own time in a comfortable space. It's not like information coming from a water hose. They have it at their own leisure. They're like, oh, okay. Wow. My dentist wasn't wrong. Turns out mouth breathing is bad for your health. Who knew? And so I really like, I have a Buteyko book I give them. I give them the decongesting, and I give them what's called a BOLT score. So it gauges like what their CO2 tolerance is. So they have something they can measure over time, you know, as they slow down the breathing. And then I have a fascia one. So I always encourage my patients to get a foam roller. I want them to go from the thoracic spine all the way up to the cervical and roll back down right before sleep. I tell them to like stretch the day away. I don't want you to go to bed with all of these forward head postures from working on a computer or the stress you keep in your body. Because there's a book, it's on my list. It's called The Body Keeps Score. Yep. I'm super excited about it because it talks about like fascia and how it responds to stress. But there's tools you can use that help to relieve. So, I mean, you're trying to give your patient the ability to make it easier to breathe while they sleep. So they don't feel so tense and locked in. And then let's see that. So I have a myo, I have a food, I have a breathing. And then a lot of times I'll just give them a little paper, and it has all these websites and all these different people that they could follow and learn from. Because I always think it's important for our patients. I mean, a lot of them are using social media. Right. So I'm like, hey, I want you to go follow Dr. Stephen Lynn's account. He posts a lot of great stuff about the tongue. So if you see it every day, there's a good chance you'll still work out every day because it'll stay top of mind. And that seems to work really well. They'll come back and they'll tell me things I didn't even know. They'll get a little hyper focused, which is good. Not too much,
Sure,
but
sure.
it's really exciting to see them connect the dots. Like I have a patient, she's actually a physical therapist, a doctor of
Okay.
physical therapy, and
Mm,
she had chronic migraines. She didn't want an oral appliance, so she wanted to go just the myofunctional route.
mhm.
And she was such, a success story. I mean, she's down to like one migraine a month, and she was having
Wow.
5 a week, and it was debilitating and ruining her life. And to know that we were able to help her get her tongue up and breathing through her nose and keeping everything in harmony. Finally, she didn't have all this facial tension from clenching and grinding. And it was just, and they're the
Awesome.
best. I mean, I get so many patients because of that one patient,
Right.
because almost all of her patients are holding tension, and a lot of them have airway disorders too, and they're not healing. So they're perpetually at physical therapy.
Yeah. And hey, I want to add one thing just for our audience to make sure it came across right. We're not saying, folks, if they're apneic and they don't want to do anything, just do myo. There's clinical recommendations for a reason. We're always following the recommendations of a physician. That's what Rhonda and her team at her dental office are doing. So if they need CPAP, if they need oral appliance, you should be following those guidelines. This is an addition and a crucial one. And if the patients are completely refusing everything, we're doing something, just like oral appliances for severe cases with CPAP intolerance. So just I want to there's our wee bit of a disclaimer there. Don't want that to be taken out of context. But I love what you're doing with that, and I love hearing that. My wife and mom have both struggled with migraines. So to hear someone being healed with that and having that much progress is awesome to hear. Yeah, very cool.
Yeah. The neatest part about that, though, is she had a sibling on the other side of the country who got expansion orthodontics because of, she said, you need to
Wow.
learn more about the tongue. And you need to, and then she's like, because of you, this cascade of events happened to where my sibling, who lives 8 states away, is addressing her airway health. So it's really exciting.
That's so cool. Hey, so practical questions. That neck massager thing that you just like randomly like pulled out of your Mary Poppins bag. What is that? And where the heck do we find it?
This is just a like generic, on Amazon neck massager.
Huh.
It's really great from C2, C3, C4.
Okay.
I've got all kinds of stuff in here, you guys, because I know that it's a forward head posture that, comes along with the floppy tongue. Like
Right.
this one is a cranial cradle.
Okay.
And so the patients just during their unwinding time before sleep, they just lay on it and it gives them that cervical relief, especially if they're doing the tongue workouts. Because a lot of them will say, it's tight, everywhere's tight. And so these tools help get them
Wow.
sleeping more comfortably and breathing better.
Yeah, that's awesome. So for those of you that are actually enjoying Mike probing questions about all these special tools, Chad's putting links in the chat. If you'd like to buy a cranial cradle, yes, I said it right. That one's in there, and he's looking for the massager too. Thanks for being awesome, Chad. That's cool. Okay, so we had somebody else ask why success rate is very low with pre-fit anti-snoring devices. Is it because of less skilled doctor using to the wrong patient, or it's ineffective? Okay, I'm guessing this is custom oral appliance versus it's preformed or home formed, like $80 Z Quiet on Amazon versus a custom oral appliance that's delivered in a dental office. I have opinions. I will yield the floor to you and add later. Go ahead. What do you think?
Well, okay. So my first thought is if it is a boil and bite appliance, something they can boil the water in the microwave, dip their appliance in, wait till it's translucent, and then fit it to their teeth, they have to realize that their body is about 98 degrees at rest. And then when we go to sleep, our core temperature raises. So every night that material remolds itself. And so these people are, going from a nice solid bite And then after a couple of months of wear of these appliances that are constantly changing, the teeth no longer come together properly.
Mm-hmm.
Or the situation I've seen before is they advance too far and they end up having condylar issues. They're having crepitus or joint pain because no one was there to titrate it.
Yep.
They're doing this in the comfort of their own home, but a lot of them will end up with an open bite, or they'll have shifting, or they can do some serious damage. The custom appliances, they're designed to fit to that person. They don't change with body heat. And they're titrated for the jaw joint health. Not too far forward, not too far back, whatever their sleep study says, hey, this looks like a good advancement. Some of them are end to end, or about 3 millimeters forward. Some of them, I've had patients go up to like 7 millimeters forward. And you have to test. You have to prove that you're breathing better and that everything's still staying healthy and stable.
Yep. Yep. And I would add on the verbiage side, people usually only go to those when they think that your solution is expensive. This is quicker, it's easier. I can get it in 2 days instead of 3 weeks. It's $80 instead of $3,000. Why would I spend $3,000 with you? It's a piece of plastic. Well, that piece of plastic is going to cost you well over $3,000 in dentistry, because it's going to start separating your teeth contacts. Like you're going to have dental related issues having something in your, not even just the effectiveness aspect of it. You're going to address your TMJ differently. You're going to have dental issues. Those are temporary for a reason. Look at the clearance that they have. They're temporary for a reason. They're only addressing a cosmetic issue. You have a life-threatening medical condition as defined by a physician. This is something that we should probably address correctly, wouldn't you think? I mean, just saying, I don't know. Maybe you can't be that sharp with the really nice folks in your practice, but sometimes it's the sharp comments like that from patients that are just hard to please. It's like, we're just here to help you. We're not here to shove something down your throat, pardon the pun, or just strengthen your throat, or squish your neck, or all the things that Rhonda does that we learned on tonight's webinar. Right? I mean, this takes training. You're not paying for the piece of plastic. You're paying for the expertise to manage your health condition by way of an oral joint stabilizer. That's what this is. And then in your practice, you're going to show them the right habits to build the right muscle strength, correct? Not tone, but strength.
Strength.
Yeah. And do the right thing. I love it. One other thing I want to say, you guys, because I know many of you, I see the names on here. Y'all are coaching clients or friends. Hey, listen, these are tools in your bag. An oral appliance is a tool to use for patients that are in a certain category. A CPAP is a tool for certain. Inspire as the hypoglossal nerve stimulator, it's a tool. So this is, for all intents and purposes, what Rhonda's sharing is a very practical, inexpensive tool set that you can help your patients widely. They don't even have to physically be in your office to do a Zoom call and send them a video and all these cool things she's talking about. This is very, very tangible, real world. We can land the plane on this and do some good work. Also, this is not a comprehensive AOMT course, people. This is just your intro into, get excited about this because Rhonda's doing great work. She's helped patients who have helped their family members. Like, we just want to do more, better together. That's the goal of tonight's webinar and our whole focus here. So, whew, wow, that felt like way more of a soapbox than I intended. You're the speaker here. Hey, since you are the speaker, I want to ask you this last one as we start to wrap up the hour. Number one piece of advice. Dentists, teams, whoever's on the call tonight, what would you want to impart? If you could tell your younger self one thing about this, what would you say to these guys?
Learn to see the signs and symptoms. A lot of patients don't have the proper baseline A lot of this stuff happened when we were children. And so we don't know how bad our sleep is until it gets better. So do your best to show with photos to your patients these areas of recession or anterior wear or tori or these tethered tissues. Show them that, they can potentially help themselves breathe better while they sleep, and you have multiple options to do that. People love choices. And so I guess the number one advice is just look at what you're already looking at through different eyes, and make sure that you give everybody the chance to know that, they don't have to continue to suffocate when they sleep. And that when I show these patients, I'm like, you see this recession, you see this anterior wear, like, do you ever wonder why this bone under your mandible keeps growing? Have you ever thought about these headaches that you're telling me you have every 2 days? Have we talked about when you open your jaw, it shifts and deviates, or that you have this crepitus, or like, oh, just help them connect, find their pain point.
Yeah.
What's the one thing that bothers them? Because if you ask them, how is your sleep? The more often than not, you're going to hear my sleep is fine.
Mm-hmm.
So you need to show what's happening in their mouth. Say, I want your teeth to outlive you. What can we do together to make that happen?
Yeah. I love that. I would say just do it. Get out there and do something, everybody. Whether it's Rhonda's 5 exercises, or it's connecting the dots, or it's registering for a course to learn more about this stuff. Whatever it is, do the next thing. Help the next person. Just take some action. Yeah, that's right, Randy. We were at we're at the Pivot Masterclass a week ago. If y'all were there, you saw Shia LaBeouf on video on the screen going, just do it. I can't really do it very well, but you should look that video up. That's homework for everybody. YouTube, Shia LaBeouf, just do it.